Hi, everybody. Welcome to our splash page. I'm Annie Neiman. I am the Director of Research for the Center for Public Interest Communications.
And I'm Jack Barry. I'm a postdoc research associate with the center.
And at the Center for Public Interest Communications, we work with organizations all over the world to apply behavioral, cognitive, and social science to their communication strategies. And over the past year, we've worked with organizations to increase vaccine confidence among the communities that are most hesitant about getting a COVID-19 vaccine. What we're going to share with you today is our approach to doing that work and some insights we have found across those different projects. And you can see which organizations we worked with in our poster or on our poster. So our approach to doing this work, the first thing we do is we do background research. So depending on the community we're working on, whether it's certified nursing assistants at nursing homes or manufacturing workers, or people who lean conservative, or people who are part of a wellness community, we do background research to understand the existing narratives around COVID-19 that is shaping their beliefs. And that includes a media scan and following outlets that they might follow to see how the narratives are shaping. The next thing we do is a literature review where we look for research across academic disciplines to understand if there's insights about these populations that would help us in identifying the challenges and increasing their confidence and also potential interventions. But we don't just stop at research about these communities. We also look at studies from cognitive science, social psychology, sociology, anthropology that will really help us understand the challenge in front of us. The next thing we do is interviews with people who are from these communities to collect their insights, to get a sense of how they think about the issue, and also to have them weigh in on potential messages and strategies that might work for them. Once we've done all that, we hold what we call a living literature review, where we bring together scholars from a range of disciplines who are steeped in different literatures as they do their work. And we ask them to consider the challenge in front of us from their disciplines to surface theories that might help us solve the problem and potential empirical insights as well. We use all of that to craft surveys that we send out to representative samples of these populations, where we go deeper into their beliefs about vaccine hesitancy, but we also ask them to respond to messages and strategies to identify what might work best for them. Once we've done all of that research, we take our data and we develop an evidence-based strategy that we share with an organization and that they put into practice. And now Jack will share with you some of the findings that we found across these different projects.
Yeah, thank you, Annie. So we could talk all day about many different types of findings, but we have 5 main ones that we found across these projects. The first is that building trust is really key, building trust in multiple different ways. We've also found that empathetic one-on-one conversations is important as well in building vaccine trust. Another aspect or finding from this research was tapping into worldviews, identities, and moral values is important. For instance, with our project with CNAs and nursing home workers, we found that their passion for taking care of people as a value was important, and messages resonated with them that were around taking care of people. Also, with our project with manufacturing workers, we found protection of family and work identity were important and popular messages with that group as well. We also found that trusted messengers who share stories are important to keep in mind with building vaccine trust. And lastly, we found that using positive emotions and highlighting the benefits to self and to your community are effective as well. So with that, we have other projects in the pipeline along vaccine trust, and we'd be happy to share more as we go. Thank you for listening to our Splash Talk, and feel free to reach out to us regarding any of these projects, and visit the center's website at realgoodcenter.jou.ufl.edu, and follow us on Twitter at realgoodcenter. Thanks.